Hello, everyone, and welcome back to another year of our Health Reform Beyond the Basics webinar series. This is Hallie Cloud, and thank you so much for joining us today. For those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in DC. This series is designed to help advocates, assisters, state and local officials, and others assist people access and understand the Affordable Care Act's health coverage options. It is intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar, the first in a four-part series on key elements of eligibility and enrollment, will provide a detailed discussion of eligibility for premium tax credits and will go over how the premium tax credit is calculated. Now, to guide us through today's topic, please welcome Judy Solomon, Vice President of Health Policy here at the Center. Welcome, Judy.
Thanks, Hallie, and hi, everybody. Welcome back to a lot of you, I think. Let's get started. We have a lot to cover. We're just going to start with a very short overview of the upcoming open enrollment period, because I'm sure most of you know that it is going to be shorter. So we just wanted to make sure that everybody understands that we will only have 45 days and all have to work really hard to get as many people enrolled during the shorter period. Now, those of you who are in state-based marketplaces, many of you already have states where they've taken action to extend those periods, which is a possibility, and up to the states. This is what we have right now. We expect there may be additional changes which we'll add to our list, and if you know about a state that's not here that has extended, please let us know so we can make sure we have the information that everyone needs. So now to the matter at hand, premium tax credit eligibility. So what are premium tax credits? Well, they're basically a way to help people with the cost of coverage when they're going into the marketplace to purchase coverage. They're very different from other public programs, the way those are administered. For example, Medicaid, where you get coverage directly, or SNAP, where you get benefits that help people buy food. Here, there's not a direct subsidy every month. That's a benefit through the tax code. But because you need to pay for your health coverage every month, people can't wait. And so there is a way to get the premium tax credits in advance. And that's what this first half of the slide shows. Most people will take it in advance, but then at tax time, they will have to reconcile the amount they got against what their final income is for the year and figure out if they got the right amount and pay back some if they got more, or get more if they got less. We'll go into that in future webinars. But people can also wait and they can enroll in a plan and pay the full premium, and then they can claim their credit at the end of the year. This is a good strategy for people who don't know if they're going to be eligible. As you'll see, eligibility caps out at 4 times the poverty level. So, and if people think their income is going to be above that, they actually would have to pay back anything they got if they took it. So people who aren't sure and can afford to pay for their care up front should maybe think about doing that. But that's not very many people who are able to do that. So there's 4 basic eligibility requirements for premium tax credits, and we're going to go through all 4 of them in detail. The first is that you have to be enrolled in a marketplace plan. So you can be enrolled in an individual market plan outside of the marketplace. There's still plans there. You can enroll with brokers, but if you do that, you're not going to be eligible for a premium tax credit. You have to be enrolled through the marketplace, and we'll talk about what there's actual eligibility requirements to enroll in the marketplace. You have to have income between 100 and 400% of the federal poverty line, with an exception, which we'll also go into, for certain immigrants who have income below the poverty line who don't qualify for Medicaid because of their immigration status. must have an eligible tax filing status. We'll say what that is in a second. And can't be eligible for most other types of minimum essential coverage, most other types of coverage, and still receive tax credits, but a lot of exceptions there. So we'll be going through that in detail. What you will quickly learn if you haven't delved into all this stuff before is that there's always rules and there's always a lot of exceptions to make it a little more complicated. So let's start with enrollment, being enrolled in a qualified health plan. Now, there are 3 requirements that everyone must meet to enroll in a qualified health plan. So even if you know your income is well above 400% of the poverty line, you're not going to qualify for premium credits, but you want to use the marketplace to get health coverage, which many people do, you still have to meet these eligibility criteria. And the criteria are that you must be a citizen or lawfully present in the United States, cannot be incarcerated, meaning in jail or prison, except if you're incarcerated in jail pending disposition of charges. In other words, if you're being held there pre-trial. You must live in the service area of the marketplace where you're applying for coverage, and that would be usually the state that you're applying in. And then you must enroll to get the premium credits, you must be enrolled in a meta level QHP, and you see here what those are. There is another plan, a catastrophic plan, that's available to people under the age of 30 and also to people who don't have other affordable options. Those plans have high deductibles, limited benefits. They do not qualify you for a premium tax credit, although they would meet the requirement to have coverage if somebody enrolled in these plans. So let's go to income. Income must be, as we said, for most people between 100 and 400% of the poverty line. The exception for lawfully present individuals is very important, and we're going to look at that in depth in the next slide, but we're not going to be able to really do the whole issue of eligibility for families with immigrants. In this webinar, we will have a very deep dive on October 4th, I think, is the date for that webinar. So this is pretty simple here. You can see what the different levels are. These are the 2017 guidelines, which are used in 2018 open enrollment. Actually, for the entire year of 2018, we'll be using those limits. So let's look at this now. This is a little complicated, so I'm going to go slow. The starting point that you need to understand is that Medicaid does not cover all lawfully present immigrants. Many of you in your experience have probably heard about what we call the 5-year bar, which makes people, legal immigrants, ineligible for a lot of public benefits, including Medicaid, in their first 5 years in the U.S. So let's look first at states that have expanded Medicaid. When someone applies and their income is in the Medicaid eligibility level, remember this is a state that has expanded, so that's below 138% of the poverty line. The first thing they would look at is whether or not they are eligible for Medicaid based on their immigration status. Do they have an immigration status that qualifies them for Medicaid? These are, again, these are all people who are here lawfully. Some would qualify for Medicaid, some wouldn't. If they are in a status that qualifies them for Medicaid, very simple, they'll be in Medicaid. If they're not, they'll be in the marketplace. They can qualify in the marketplace even if their income is below the poverty line. So we're talking about, say, for example, someone who is here on a visa. They normally wouldn't meet the Medicaid requirements, but they could qualify for premium tax credits. In states that haven't expanded, it's a little bit more complicated. if the person meets the Medicaid rules for immigration status, essentially they're supposed to be in Medicaid. However, if the state hasn't expanded and their income is below the poverty line, not only can they not be in Medicaid, but they're not going to be eligible for premium tax credits, because just like citizens in those states, the reason they're not eligible isn't because of their immigration status. If the state had expanded Medicaid, they would be eligible. The reason is because of their income, essentially. They're below the poverty line and their state hasn't expanded Medicaid. And the premium credits generally only cover people above the poverty line. People who would not be eligible for Medicaid based on their immigration status, even if the state had expanded, on the other hand, just like in the expansion states, can get premium tax credits. As I said, this will be definitely a deep dive with lots of chances to ask questions in October. So let's talk about filing status. What are we talking about when we say an eligible filing status? Well, because this is a premium tax credit and it's paid through the tax code, you have to be a taxpayer with an eligible filing status. You have to file a return as a taxpayer. You can't be apply and be a dependent of another taxpayer. That doesn't mean that dependents can't be eligible. They can be eligible, but the person who files for the credit on their behalf has to be the taxpayer. And here, when we say taxpayer, we mean also the spouse, who are considered joint filers. Now, there are some dependents who file their own return. They have income and they want to get back withholding, for example. But if that doesn't matter. If they are a dependent, even if they're filing a tax return, they can't get premium tax credits on their own. Again, they can get them along with whoever they're the dependent of. There also is a requirement that if you're married, you must file a joint return. Now, in general, people who are married filing separately can get credits, but we have exceptions. We also have an important exception to the joint filing rule called head of household, which we are now going to talk about. So what's a head of household? These are some people who are married, but they don't file taxes with their spouse. They can qualify for premium tax credits if they file as head of household. Now, many people would come to you and say they file as head of household. You don't have to worry about it. You can just know that they're eligible. This is really the criteria for filing as a head of household. You don't need to go into that. If they're filing as head of household, they know they meet these criteria. But if you encounter someone who says they're married and they file separately, you might want to think about these criteria and whether or not they might want to file in that way. We have a publication called the Health Assistor's Guide to Tax Rules that goes into this in more depth. But again, we don't want you to start counseling people on how they should file their taxes. This is just so you know that when someone comes and say they're married but they don't file with their spouse but they file as head of household, you can keep going. Now there are two exceptions for the people who are do file as married filing separately, and they're here. Domestic abuse, someone who lives apart from the spouse and can't file a joint return because of that abuse, and abandoned spouses. These are people who are, again, living apart and they don't know where the spouse is after due diligence. That's the language from the exception. These exceptions can only be used for a maximum of 3 consecutive years. I think the assumption is by that time, if these things still apply, that the person would have a chance to get a divorce and would no longer have to file as married filing separately. So let's do the last one. This one is, again, it's tricky because right up here we say no minimum essential coverage, but the reality is it's most of the time if somebody has other coverage available, they're not going to be eligible for premium tax credits, but there's a lot of exceptions here. The two largest categories of other coverage are government-sponsored coverage, and we list those there, and employer-sponsored coverage. And most offers of employer-sponsored coverage will end up keeping people from qualifying for premium credits, but there are two very important exceptions if it's unaffordable or it's below minimum value, or if the person who has the offer is the employee is not, so if someone is offered coverage from an employee who, and they're not on that person's tax return. The most common example of that would be children under, well, young people under 26 who can get coverage through their parents, but they're not a dependent of their parent on their tax return. They are filing on their own. They can get premium credits. They can choose to forego the coverage through their parent and get premium credits. And we have an example to go through on that. And then there's a third category, which is less common, and this is coverage that the Secretary of HHS says is minimum essential coverage. And in some cases, again, but not all, that might keep a person from qualifying for premium tax credits. We have a reference chart that goes through this. It's here, it's linked here. It really is something you may want to consult because this is something that, you know, on the fly, especially in the short open enrollment period, you may need to better understand. So let's go through these different types. Government-sponsored coverage, you see here we have really two sides. Most provide coverage that's would keep someone from getting premium tax credits. Medicare Part A, however, there are people who have to pay a premium for Medicare Part A because they don't meet the qualifications. If that's so, they might be able to get a premium credit, but most Medicaid, most children's health insurance, you see those there. On the other side, you see that there are Medicaid limited benefits that don't bar eligibility for premium tax credits. And in some cases, these aren't even minimum essential coverage. The distinction I'm making here is that minimum essential coverage is enough to qualify, well, to exempt you from having, to keep you from having to pay a penalty. But not all forms of minimum essential coverage would necessarily bar premium credits, although most do. Some of these forms of Medicaid are not even minimum essential coverage, so enrolling in them would not avoid the penalty. And I'm sure right now I've just confused everyone because they think I confused myself. But we'll come back to that, and hopefully the examples will make this clearer. So this too can be complicated. People are not eligible for premium tax credits if they are eligible for employer-sponsored insurance that is both affordable and of minimum value, and or even if it doesn't meet those tests, if they're enrolled in the employer-sponsored insurance. So everybody sort of on the left side here would not be eligible for premium tax credits. People who would be are people who, where it's not affordable, it's not minimum value, they didn't enroll in it. People who are in a waiting period, so you get a job and they say, well, in 3 months you'll have coverage. During that 3-month period, eligibility for premium tax credits exists. And then people who are eligible for COBRA coverage. COBRA coverage is what is often offered at the end of a job period. People usually have to pay the premium themselves, or retiree coverage. Eligibility for those forms of coverage do not disqualify people from premium credits. So let's look at our first example. And this is Serena. And we're looking here at the impact of the option to enroll in COBRA and what that does to Serena's eligibility for premium tax credits. So last month, Serena left her job and she had health insurance. She can enroll through COBRA, but it's very expensive. She has to pay this full cost and she hasn't enrolled in it. Can she qualify for premium tax credits? Well, the answer is yes. The option to enroll in COBRA does not bar her from eligibility for premium tax credits. She has, because she left her job and lost her job-based coverage, she would have what's called a special enrollment period, and we'll do a whole webinar on that later in the year. So even if it's not open enrollment, she can go to the marketplace and enroll in coverage and get premium tax credits if she's eligible. Okay. So what happens if she enrolled, she didn't know she had another choice, she took it and now she knows she made a mistake. It's really expensive, and she hears about marketplace coverage. Can she drop it and qualify? Well, the answer is being eligible for COBRA, we talked about that before, doesn't bar eligibility, but she can't be enrolled in the COBRA and get the premium tax credits. Her problem is not so much eligibility, but it's whether or not she is able to enroll. Is it a time of the year she can enroll? If she did this during open enrollment, she could drop the COBRA and enroll in a qualified health plan. If it's February outside of open enrollment, dropping it does not trigger a special enrollment period, unlike losing her job or quitting her job, which did, and she will have to wait until the next open enrollment period to enroll in a qualified health plan. So if she wants to remain covered, she'll have to hold on to the COBRA until then. Okay, let's dive a little bit more into employer-sponsored insurance and eligibility for premium tax credits. An individual is not eligible for premium tax credits if they're eligible for employer-sponsored insurance that's adequate and affordable. So what do we mean when we say that? Coverage is considered not to be affordable, not affordable, if the employee contribution for self-only coverage is more than 9.56%, and this number changes every year. So for 2018, it's 9.56%. Now, what's really important is that contribution for self-only coverage is the measure of affordability, not only for the employee, but for other members of the family who have an offer through the employee coverage. And we'll show this in examples so you can get your head around. Adequacy, no, this is less common. This is actuarial value is a measure of the generosity of the coverage. People are not going to kind of know what the minimum value of their coverage is. It's something they have to get from the employer. Most employer coverage is considered adequate, but in some cases it won't be. And if it's not, then it would not bar the employee or other family members from getting the coverage. So this is where I think examples can be really helpful to get a sense of that. But first, just another sort of iteration of the issue of the family coverage. So let's say a family had household income of $40,000 a year and employee-only coverage was $150 a month, which is 4.5% of their income. But if the entire family was covered, it would cost 13.5% of income, $450 a month. The employee-only coverage is considered affordable. It's less than 9.56% of the family's household income. means the family members are ineligible for premium tax credits, even though it would be so expensive for the entire family to enroll in the employer coverage. This is often referred to as the family glitch. And it is quite a glitch. And the exception, we went through that already, and we'll go through an example, is if the family member who's offered through the employee's coverage is not on the same tax return, they're filing their own return, they're a taxpayer themselves, then the offer would not have an impact on that person. So let's look at an example. Here we have a family, you can see mom, dad, 2 kids, family income at 200% of the poverty line. Monica is working, her employer offers 2 different plans. Plan A, you can see it is 4.8% of income for the employee only coverage. Family coverage, a lot more expensive, 13% of income, and it meets the minimum value test. Now there's another plan that's much cheaper, and it doesn't meet the minimum value test. In this example, no one qualifies for premium tax credits because the offer of Plan A is affordable and meets minimum value. The family could take up Plan B. That would meet the requirement to have coverage, even though it doesn't meet the minimum value test. It's considered minimum essential coverage. It wouldn't be of that much value to them. That would be their choice. But they're not eligible for premium tax credits, unfortunately. So let's look at these young adults. You know, we were talking about, you know, the fact that in many cases, they may have offers through their parents. So we're going through an example here of John who has multiple options for coverage. He's filing taxes on his own. He has income at 200% of the poverty line. His employer offers coverage. He also has the option of staying on his parents' plan until he's 26. So his first choice would be this employer coverage. It doesn't meet minimum value in our example, so he would still be eligible for premium tax credits. You can see, and we're going to go into the second part of this is going to be explaining how we got to his cost of coverage after his premium tax credits. But for now, it would cost him $123 a month. He'd have a pretty generous plan. 87% actuarial value, and he also has this option to enroll in his dad's employer plan. Wouldn't cost him anything. That option does not bar him from premium tax credits either, because he is filing taxes on his own and can claim his own premium tax credits if he wants to do that. So if for some reason, even though the dad's plan was cheaper, maybe it doesn't have good network in where he lives, he might still decide to go with marketplace coverage.
And we're going to stop and take just a couple questions, and then we'll take most of the questions at the end of the presentation. But just a couple quick clarifying questions. Back to the rule about having an eligible tax filing status, and we mentioned those exceptions to the joint filing rule. So someone who is married filing single due to either abuse or abandonment, how do they apply to the marketplace? How do they get through the market? Do they have to call the call center, or can they get through the application?
If I'm remembering correctly, and I'm looking at my colleagues here, they actually would say on the application that they are single and filing individual, and they're nodding their heads. So this is a problem for the head of household too. There's nothing on the application that actually says I file as head of household. There's your file as a single individual. Well, married. Are you married? Are you filing as married? or are you filing married filing separately? If you say married filing separately, you're not going to be eligible. So people have to say they're married, even that they're filing as an individual. I'm sorry. I'm sorry. They should just say they're filing as an individual, even though they're married. They should not say they're married filing separately.
Perfect. And then we had a couple questions on
Oh,
our,
excuse me.
oh
One
yeah,
second. Yeah, we'll be going through that in detail on Thursday.
yes, yes, we will. And we also, as Judy mentioned, will have an entire webinar dedicated to eligibility for families that include immigrants, and that'll go into a lot of detail on some of the rules around that, because it can get really complicated very quickly. And that will be on October 4th. So for offers of other coverage of kind of what counts as minimum essential coverage, there was a couple questions about if some states offer Medicaid coverage for pregnant women, and so whether that offer of coverage bars eligibility for for premium tax credits.
So it depends on whether or not it's considered. So sometimes it's considered minimum essential coverage, and it also depends on whether or not you were enrolled in the marketplace before you qualified for that coverage. If you were enrolled already, you don't have to drop your marketplace coverage and go into Medicaid. If you're applying for the first time and you qualify for the pregnant women coverage and the cover, you're in a state where that's considered minimum essential coverage, and there's a link to the designations on the slide, then you would have to take up the Medicaid for pregnant women, and then when that ends after 60 days postpartum, could go into marketplace coverage.
Perfect. And then just one other question. Someone had a question about VA coverage and where that sort of fits in the government-sponsored coverage.
VA coverage is actually, it's a little complicated because the marketplace can't determine all the different kinds of VA. Essentially, people can qualify for premium credits even if they have an offer of most forms of VA coverage. But I think all of that is in the reference tool.
Perfect. Thank you. Thank you for the clarification. And then we'll take the rest of the questions at the end of the presentation. Thanks.
Okay. So we're going to talk about how the premium tax credit is calculated. This is the formula. The amount of the premium tax credit an individual or household gets is the difference between the benchmark plan, the cost of the benchmark. The benchmark is the premium for the second lowest cost silver plan, individualized, available to each eligible household member. So what would it cost the person to enroll in the second lowest cost silver plan, minus what the expected premium contribution is. And the expected premium contribution is based on household income on a sliding scale as a percentage of the poverty line. So we're going to go through each element of this calculation. Just to sort of give you the picture of what the second lowest silver plan is, what the benchmark is. Silver plans have a 70% actuarial value. That means that in the aggregate across the whole population, the insurer would pay 70% of the healthcare costs and individuals would pay 30%. That does not necessarily mean that's what any individual person pays. That is in the aggregate. So you can see on this scale that silver is 70%, and then gold and platinum are more generous, and bronze is less generous. The benchmark is the second lowest silver plan. Now this is the sort of little ugly, somewhat picture of the household contributions as a share of income. So you can see that it remains at what is now 2.01%. These go up every year. It started at 2% in 2014. Didn't go up a lot, but it stays at 2 until you reach the poverty line. And then you have these sort of increments. It's not a true slope. And then at 300% of the poverty line, the contribution maxes out, and everyone from 300 up, their household contribution is 9.5% of their household income. So this shows it as a chart and shows kind of the range. I actually said that it's under 133, not the poverty line. The graph is a little hard to read, but under 133%, 2.01% of income, and then it starts sort of going up from there. And you can see what that is on an annual basis, what the contribution is. Now, there's different things that affect the cost of the benchmark plan. So it's not just, when I said what I meant when I said individualized is the cost of the benchmark plan is really based on the person. And it varies based on age. So the very youngest people, say a 20-year-old, is relative to an older person, a 64-year-old, going to pay a premium that's like 1/3 of what that older person pays. There is a limit on the variation, and there are some states that actually limit it more and have everyone, like New York, where everyone pays the same. There's no age variation, but almost in every state it's 3 to 1. And there'll be a determination. You don't have to know what it is and how it's done because it's all in the computer, that even when someone is, the difference between being 30 and 31 is going to affect the premium. Family size. The benchmark is calculated based on the total premium for the family, and you take the ages and for each one and calculating that, so it's the sum of the premiums for each family member. There is sort of a cap, though. If families have more than 3 members under 21, you only count the 3 oldest children. So the others sort of come in for free, essentially. But that's an unusual situation to have households that big in terms of who's been enrolling. Other factors, the other factor that affects the cost of the benchmark plan is where you live. So every place is different in terms of what the premiums are. So where you live is also going to affect the premiums. Other factors don't necessarily affect the benchmark, but they affect the premiums, and we have examples for all of these. Tobacco use is one. So people that use tobacco can be charged up to 1.5 times what they would be charged if they didn't use tobacco, and this is not accounted for in the premium tax credit calculation. So essentially, they would have to pay the difference. They would have to pay this excess premium that's due to the tobacco use, and we have an example that shows how that plays out. And then once you get your premium credit, you go shopping, and what you actually are going to pay for your plan is going to be based on the plan you pick. So if you pick the second lowest silver plan, if you pick the benchmark, you're going to pay that household contribution that was calculated to determine the amount of your premium credit. But if you pick a cheaper plan, you're going to pay less. And if you pick a more expensive plan, if you pick a gold plan, for example, you're going to pay more, or even a more expensive silver plan. And we have examples on all these things. So here we have a family. Their family income is 200% of the poverty line. For people at 200% of the poverty line, they're expected to contribute 6.34% of their income. You can see what that amounts to. And you see what the 3 lowest silver plans are in their area. The second lowest plan will be the benchmark. So that's the what's going to be used, and the calculation is the benchmark minus the expected contribution, and there's their premium credit, $619 a month. Take it on the marketplace and buy a plan they want to buy. It doesn't have to be the benchmark. They could buy Plan C, and you can see there, well, you can, Plan A is what I wanted to make it go farther. The cheapest plan, which is Plan A, and you can see that their cost would be less than if they bought the Plan C, up to them. Let's say now that the kids in the family are eligible for CHIP, so they don't need coverage in the marketplace, and just Teresa and Antonio need it. So the benchmark is less because you're only covering the two people. So you're only adding together the coverage for Teresa and Antonio. It's $7,322 a year. But the calculation, their contribution doesn't change because that's based on their income. So what happens is they have a smaller credit, but of course the plans are cheaper because they're only covering the two of them. Now let's just look at this again as sort of a chart comparing the situations. And you can see that the key takeaway here is that the benchmark plan, what it costs affects the amount of the credit. It doesn't affect the contribution. They're always going to be expected to contribute that amount based on their household income. Difference in the benchmark is going to affect how much they get, not how much they have to contribute. Here's another example using John at two different income levels. So if his income is 200% of the poverty line, his expected contribution is 6.34%, and his premium tax credit ends up with a benchmark plan of 2535, his premium tax credit ends up a little over $1,000. If his income goes up, not only is there more income to apply the percentage, but the percentage is higher. It's now 8.10%. So you can see even that, relatively small change in income as a percentage of the poverty line makes a big difference in his premium tax credit because his contribution is bigger. Now let's look at age. Again, looking at John, and we're changing up the example a little bit, but he's going to contribute $1,006. I'm sorry, his premium tax credit is $1,006. Let's say he's 64. We have a different John who's 64. Because his premium is going to be considerably more, if his income's the same, he's still going to pay the same amount, but his premium credit is much bigger. And this is really important because as we think about this year where prices might have risen, just like for age, the premium credit protects people who are eligible for it against the premium increase. Their contribution is always going to be that percentage of their income. If the benchmark price goes up, then the premium credit is going to go up and their contribution, but their contribution doesn't. So that's really important. Now, let's look at what happens if John smokes, because here the premium credit does not go up. So this is the example when he's a non-smoker. When he's a smoker, the premium credit goes up. It's 1.5 times what he would have paid if he didn't smoke. His contribution stays the same, and he's expected to cover that entire amount. He doesn't get a bigger credit because of the smoking surcharge. Finally, let's just look at what happens based on different choices of his premium of plan. So here he buys the benchmark. Its contribution is 1526, which we've gone through a couple times. That's his share of income he's expected to contribute. But if he buys the lowest cost silver plan, his contribution goes down because his premium credit stays the same and it covers more of the cost. Even more so if he buys the cheaper bronze plan. Now, what we'll be covering later is the possibility of cost sharing reductions for people like John with income below 250% of the poverty line. If he buys the bronze plan, it's going to have a pretty big deductible, and he's not going to get any help with the deductible, so he might want to buy that silver plan. And then if it's the gold plan, obviously a lot more expensive, what he's going to have to pay is a lot more. So again, this is just to show you that the premium credit, once it's calculated, it's really up to the individual how they want to use it and what they want to buy. And that choice is going to have an impact on how much they actually pay. So we do, I think, have a little bit time for questions. Here are the contact information that Hallie gave you, and here are the upcoming upcoming webinars starting with Thursday, and I think we'll have some more after that. Hallie can confirm, covering some other areas. So I think we have Hallie, more time for questions a little bit?
Yeah, we have a little bit of time. And yes, as Judy said, we'll have more webinars beyond these four. So we'll keep you updated. You can go to that upcoming webinars page that is linked on the slide, and that will be up to date with registration and save the date for other upcoming webinars. So let's take some questions. First question, which was a really good one. If a family decides to enroll in employer coverage, but the benefits offered do not meet minimum value, will that family be fined for, will they have to pay a penalty at the end of the year if they enrolled in this coverage that did not bar them from premium tax credits, but they didn't know that and they enrolled?
No, it's a really simple answer is no. So this is where it gets sort of complicated because there's the concept of minimum essential value, which is what you need to have to meet the individual responsibility requirement. And then when we're looking at employer coverage, the concept of whether the employer coverage bars you from premium credits, which is different. So you could have an employer plan. Employer plans are minimum essential coverage. I think that's the easiest way to say it. That said, there's a separate test whether they bar you from eligibility for premium credits. So if a person enrolls in a plan that wouldn't have disqualified them from getting premium credits, it doesn't mean it's not minimum essential coverage. It is minimum essential coverage, and it covers them as far as meeting the individual responsibility requirement. It's a very complicated distinction, and it's hard to explain, and we often shortcut and say, if you're eligible for minimum essential coverage, you can't get premium credits. That's not really the rule. The rule is if you're eligible for minimum essential coverage, that's in the case of employer coverage is affordable and adequate. And then in the case of some of these other forms of coverage, where there's exceptions that even though they're minimum essential coverage, they may not bar you from premium credits. It's complicated. That's why I think that tool, it took us a lot of work to get that tool together and figure out the language to make it understandable. I think it can be a really helpful tool in making those distinctions.
Yeah, absolutely. And since I flubbed this question earlier, going back to VA coverage is one of those sort of exceptions. So if you have an offer of VA coverage, you are still eligible for premium tax credits if you're not enrolled in
Or
the VA
COBRA,
coverage.
it's the
Or
same
COBRA.
thing. A
Hmm.
COBRA, all of those things are still minimum essential coverage for the purposes of the individual responsibility requirement. So there really are two different concepts going on.
Perfect. All right, and then let's see. So for if someone, this kind of goes back to the beginning, but we had a question about if someone is incarcerated and whether if someone was incarcerated in the past, if that affects eligibility in any way. Um, and the answer is no. It's just if you're incarcerated at the moment, you're not eligible for premium tax credits, correct?
Correct.
Perfect. Um, and then we had another question about calculating household income for family members when they're applying for a marketplace plan. And we're not going to go into that in this webinar, but please join us on Thursday at 2 p.m. Eastern Time, 11 a.m. Pacific Time, and we'll go into determining household size and then how you calculate income for a household. So that'll go into that in a lot of detail. So join us for that webinar if you have questions about that. And then let's see, we'll take a couple more questions. So one
I just
moment.
want to clarify one thing before I know I sort of on the married, not married. For the people who are either married, filing separately, and claiming the domestic abuse or abandonment or the head of household, they will have to say they're not married on the application, just to make that clear. I think I went all over the place on that. So the choices are not married, married. And if you say you're married, they're going to ask you if you file jointly. And if you say no, they're going to disqualify you. So you have to say you're not married.
Perfect. Um, and then we have a fair amount of sort of more complicated questions. So if you have a question that didn't get answered or it's more complicated, please email us. The easiest email is beyondthebasics@cbpp.org. So please email us your questions. You can email your questions directly to me. My email is cloud@cbpp.org. And I think we're going to bring this webinar to a close. As a reminder, we're going to be distributing the materials from the webinar today. We'll do that in an email, and we're going to post everything to the Beyond the Basics website. We will post the slides later today, and we'll have the video up sometime in the next week or so, and we'll send out all 4 videos from this sort of 4-part series that we're doing. We'll send those all out together for you guys so you can have all 4 parts together. As I mentioned, part 2 is scheduled for this Thursday, September 21st, and it's going to detail the rules used to determine household size, and we'll explain what counts as income when determining eligibility for premium tax credits and for Medicaid. So you can register for that webinar and for our other upcoming webinars on the Beyond the Basics website under upcoming webinars. All of the materials from our Beyond the Basics project are posted to that site. So we have reference charts, guides, frequently asked questions, key facts. We're going to be updating all of those things, so everything should be as up to date as possible, and we'll have new resources coming out as well.
Hallie, can
As
I
I
just say 2 things?
Yeah. Mhm.
So number one, I know for some of you Thursday is a holiday, Jewish holiday. So just so you know, we will have the recording and people can watch it if you're not
Yes.
able to join live on Thursday. And the second thing is that this year with the shorter open enrollment period and a challenging environment, we are kind of ramping up our resources here under Beyond the Basics, working with some other organizations who have expertise and in different areas. They'll be helping us with webinars, but also I think you should feel free to take Hallie up on the offer of sending your questions. Many of these questions become pretty complicated. They're individualized. We can probably better deal with them on an individual basis than through the webinars, although we may, and we've done that in the past, once we get these and we feel like their general applicability, we'll post them so that everybody can see what those answers are. So don't hesitate. We really want to be available to all of you this open enrollment season, which is going to be challenging, but we're really dedicated to getting people enrolled and covered this year.
Absolutely. And along those lines, we will have uh, a video and sort of fact sheet on how the renewal process for people who are automatically re-enrolled in plans for this open enrollment period. We'll have those resources up on the website soon, so stay tuned for that as well. Um, and with that, I think we will bring this to a close. So thank you again so much for joining us. And again, we'll have the video for this webinar and for Thursday's webinar up on the Beyond the Basics website as soon as we can. So thank you so much, everyone.